few extra glasses of champagne, boxes of Christmas candy, and multi-course holiday feasts are all the things you indulge and overindulge over the holiday season. But the constant flow of alcohol, salt, and fat could be doing a number on your heart and increasing your risk for a condition known as holiday heart syndrome. What is holiday heart syndrome? The HHS is defined as alcohol-induced atrial arrhythmia. It happens due to excessive alcohol consumption or binge drinking, especially during holidays.
In medical terms, what we call as atrial fibrillation. So what happens is people go to party, they drink a lot of alcohol, and they are stressed out, they are dehydrated, and they start having disturbances in their rhythm. They start having palpitation, they may have sweating, they may pass out, and they start having breathing difficulties. So this alcohol-induced atrial fibrillation is called holiday heart syndrome.
What are its symptoms?
Symptoms would be palpitations, shortness of breath, chest pain, and giddiness, sometimes a fall. This generally occurs in patients who do not previously have any heart disease. Most of the patients who present with holiday heart syndrome are generally very fit young adults having a binge alcohol consumption followed by irregular heartbeats and palpitations.
So why does HHS occur after ingestion of alcohol? After binge drinking, the atria or the upper chambers of the heart start beating rapidly at a rate of 200 to 250 beats per minute. And the ventricles, lower chambers of the heart, also beat rapidly at more than 150 beats per minute. As a result, the heart will be underfilled and will not be able to pump adequately in keeping with the needs of the body. As described by Philip Ettinger in 1975, this occurs in persons who binge drink, that is, have more than 5 to 6 drinks in a row on one occasion in rapid succession. So what can you do? After recuperating from a period of excessive alcohol use, holiday heart syndrome typically disappears within a few hours.
It generally gets controlled within 24 to 48 hours. If it's not getting controlled, you need to consult your physician who will start you on some drugs, generally called beta blockers, and generally it is controlled with these beta blockers. So it rarely is persistent. If it's persistent, it needs a long-term treatment.
So how can you prevent holiday heart syndrome? Though it may resolve on its own, it may lead to cardiac complications. Moderation of alcohol consumption is a key factor in preventing holiday heart syndrome. Avoid excessive exertion during drinks. Hydrate yourself well and avoid or minimize consumption of high salty foods, caffeine, and sugar. It can be controlled by medication, but sometimes there is a risk of collapse. So be responsible, drink moderately, and have a happy, relaxing holiday.
For more informative videos like this, keep watching India Today News Mo.